Welcome to the Biotech and Life Sciences podcast, where we focus on inspirational CEO stories. I'm your host, Tim Dougherty. Thank you for joining us on the inaugural edition of the podcast focusing on exciting personalities in the life sciences and biotech field. Today, we're privileged to have with us Dr. Jayne Morgan. She's a cardiologist and the executive director of the COVID task force for both the Piedmont Health System here in Atlanta, as well as for the governor of the state of Georgia. She serves as an expert medical contributor at CNN and is the owner and creator of the social media series, The Stairwell Chronicles, focused on COVID vaccines. Initially, Dr. Morgan came to the Piedmont system as the director of cardiovascular research, where she led Piedmont to the #1 status worldwide in the tricuspid space and the #1 status nationally within the mitral space of transcatheter valve technologies. Jayne, it's a pleasure to have you with us, and you currently work at the largest healthcare system in the state of Georgia.
Thanks, Tim.
And you grew up right here in Atlanta. So tell us, what was your fondest memory about growing up in Atlanta?
Oh my gosh, my fondest memory. So many memories. I did grow up here, was born here, was born at a hospital called Hugh Spalding Hospital downtown, just not there anymore. It's been converted. But at the time, it was the only hospital where any people of color could be born. So that's where I was born, small hospital called Hugh Spalding. I remember growing up here, a couple of things. Delta Airlines was here, and locally we called Delta Airlines the Blue Bird. And there used to be a huge billboard right at the intersection of I-20 and 7585, a giant billboard shaped like a blue bird. And it simply said, "Fly the blue bird, fly the blue bird." And everybody knows what that was. And whenever I would see that sign, I knew that I was getting close to my grandmother's house, because we would have to turn onto 7585. I didn't know the names of the highways, but when we got to the blue bird, that was where we were getting close to my grandmother's house. Of course, at the time, I didn't know that the whole world didn't know that Delta was the blue bird. That was all that I knew of for it. But the entire billboard was made like a bird, and it lit up at night. It was all blue. And so I always liked that memory. I always liked the memory as well of my first job was at Six Flags over Georgia. To this day, it's probably still my best job ever, working at Six Flags when I was 14 years old. I sold ice cream. In fact, I didn't even sell ice cream when I first got there. I gave the girls who worked the ice cream carts their breaks. So I circled the park, giving people 15-minute breaks, 30-minute breaks, so that they could go and eat. And so I went all over the park working ice cream carts. And then later, they awarded me with my own cart. And then I had my own cart, and somebody else was the break girl.
Great. Those early jobs when we we're young are some of the best memories, I think.
Absolutely. You've got freedom. You have money, all the money that you need, because you really don't need any. Somebody else is taking care of you. So it seems like so much money.
Right. You never knew you needed money until you had some.
Right. Exactly.
Right? But so the common thread throughout your bio, Jayne, and just in getting to know you, is that you have a wonderful ability to communicate and make complicated subjects eminently understandable. And your expression of that quality in the Stairwell Chronicles about COVID, is just an extraordinary example of that quality. What motivated you to start the Stairwell Chronicles?
Well, thank you so much, Tim, for that compliment. I appreciate that. I was motivated to start. I really got my first COVID shot. And it was clear to me, and certainly in the African-American community, that there was a lot of reticence. And I could also see in other areas. I was working at the hospital, even staff really were unsure about this vaccine. So I decided to record myself getting vaccinated and then talk about it. And literally, when I got ready to talk about it, I just sat down on the stairs of my porch. Initially, I was going to do it outdoors on my front steps and sit outside. And the day I got ready to do it, it was kind of overcast and we couldn't get a clear picture. So I moved indoors. So if you ever see the very first one that I've done where I'm sitting on my stairs, I'm actually wearing a coat because I was outside and it was in January, but I couldn't get good light. And so I started talking from the stairs there. And the reason it's called the Stairwell Chronicles is really hokey. I literally couldn't think of a creative, fun, apt name. So I named it exactly what it was. The Stairwell Chronicles. I'm going to talk from the stairs. It was just literally, I didn't have enough imagination to come up with something like the Blue Bird.
Well, I think it took a lot of imagination. I wish I had thought of it myself for this. But managing communications in a public health crisis for an entire state has to be just a daunting task, especially with a subject as politically charged as COVID's been.
Right.
How did you come to accept that responsibility? And what was your kind of vision when you went in, and how did it sort of progress as we went through the pandemic?
And so I felt I had a responsibility to society to explain the vaccine. And I understood that I was really uniquely positioned to do that because I came out of industry. I came out of pharma and devices, R&D. The vaccine development was exactly what I used to do for years. I understood all the phases. I understood what the decision-making processes were. I understood what that recruitment of patients were. I led a study site. And so, from stem to stern, I was probably one of the few people who actually understood the whole process, who literally had worked at every stage of the process, all the way to the end user where you're giving it to the patient. And so I decided, let me sit and began to talk with people, because the other thing that was concerning, even to doctors, was this messenger RNA. Most people have no idea what messenger RNA is, right? That sounds like DNA, right. It sounds like RNA. What's the difference? And even doctors, after we get out of medical school, unless we're in research or doing something, we're not really steeped in messenger RNA. And so even for doctors, it was sort of a wake up, like, oh, we're going back to messenger RNA. And so I really started as an opportunity to begin to explain it, naively thinking we would get to the end of it. Let me sit on the stairs 2 or 3 times and explain this. We can just wrap this up. I think people just don't understand. I'll just explain it and then it will be done. And then, of course, more and more information. So then it started to be a routine. And then people started to like it and started to anticipate what my next question was that I was going to be addressing, and it started to be effective. And obviously, as you know, the rollout was more complicated than we anticipated. The getting vaccines into arms was more complicated than we anticipated. All of the political atmosphere. And so it started to be really a big issue, but literally I started just to demonstrate, hey, I got the vaccine. Look, I don't have 4 heads. I didn't grow 3 legs. Look at me, I'm fine. And let me answer a couple of questions. I didn't have a great imagination. I was sitting on the stairs. I was going to chronicle it. So I just called it Stairwell Chronicles. And I had no idea the legs that it would take on when I started it. And certainly I didn't know that this pandemic would move on for 2 years. Did not have that in mind either. So thought this was all short term, but it wasn't. And I didn't understand the power of social media and how people were really going to be steeped in misinformation and intentional disinformation campaigns, fear tactics, all of that. I initially had to continue to address in my Stairwell Chronicles that I had no inkling that that was coming when I started. So truly altruistic. A social, sort of a societal venture to just reach out and help humanity understand messenger RNA, the vaccines development process, hospitals, that type of thing.
And that sort of grace to take on that sort of responsibility is something that I've found so compelling as I've met people in the healthcare field.
Mm-hmm.
There's this complete disregard, in a sense, for the importance of money, which is what my field is all about.
Right.
It's only about money. And when you get to meet people who are really involved in healthcare, you find that that's the furthest thing from their mind.
Mm-hmm.
They may be wearing two different socks, but they just don't care about it.
Right.
It's the science, or it's the particular disease that they may have some personal involvement with, some member of their family or something like that. And it's really, really compelling. And I don't think people understand it. What do you think was the biggest challenge you had? And how did you resolve it?
I think probably the biggest challenge that I had was, I think, in the fourth surge, when it really was clear that disinformation was driving a lot of the chaos behind the scenes. And in that surge, that was with the Delta variant. That was the first time that I really took on disinformation campaigns in my stairwell chronicles. So all the nonsense that I was seeing on social media, I would actually take that and address that issue on my stairwell chronicles. I know you've heard about X. Let me explain to you why that's not true. And then I would take that. And really, that was probably the most challenging, because to me, from a scientific perspective, it was all hocus pocus and nonsense. So I was surprised that people were taking it so seriously. It took me to the fourth surge to say, oh my gosh, people really believe that. It never occurred to me that people would believe it. And so in the fourth surge with the Delta variant, I literally stopped and began to focus on all of these things that I had sort of poo-pooed, that, oh, that's not important. Nobody's going to believe that. Let me focus on the important things. Let me just focus on getting this information out, when really the disinformation was undermining all of not only my efforts, everybody like me, every scientist, every physician, everybody who was trying to get out in front and talk with patients and talk with people. It was undermining our efforts. And so it was really at that surge, which was late. That was the Delta variant, the fourth variant, that I really had to stop and say, oh my gosh, I'm going to have to address this head on, not just me, other doctors as well. And so the veracity of this disinformation throughout all of social media was just astonishing to me. And it took me a long time to understand how powerful and relevant it was.
The juxtaposition of that disinformation with the positive information coming out of healthcare, with all its issues at the CDC, et cetera, is just amazing. Just amazing.
Right.
To me.
And I always keep my stairwell chronicles positive. So if anybody's listening, you're like, oh my gosh, it's probably this angry vignette. It's not. It's always very positive. It's very short. It's only 60 seconds. So I'm not there on a soapbox. I take 60 seconds to answer this question and close it out. And the point is really for people to take just one leaf, not to drive you towards getting a vaccine, but just to take one leaf of information, place that leaf on a branch, and keep coming back and listening to me talk in these 1-minute segments, and you kind of flesh out this branch. And eventually you have a tree, and you've got sort of a tree of knowledge that hopefully can sustain you through all of the disinformation. So it's a process. And I think I've gotten so many comments where people followed me over time and then said, I finally got the vaccine today. I've been following you for 3 or 4 months. And today I did it. And so that's really it, not hitting you over the head with a hammer, but giving you pearls and pieces of information of science, demystifying science such that everybody can understand what it is that we're talking about.
It's so interesting because I think that the thing that I've learned as a non-scientist, the thing that I've learned from the pandemic was that with all the faults, CDC, et cetera, that everyone in that system, regardless of mistakes, did their best. And the way that is separated from the disinformation that's out there and the vitriol, and it's just amazing.
I think by and large, that's true. I mean, certainly we had outliers, and it was so, unfortunate to see people with physician credentials using them for ill will. And I hated to see that. But by and large, unfortunately, those voices generally had a big platform for whatever reason, including in the government. But you're right, the understanding of the medical and scientific community as a whole, those outliers notwithstanding, was absolutely in concert. And we understood the importance of this. And we were the ones on the front lines. And we were also the ones, accepting the risk of the consequences of your inaction became our risk.
Right.
Right.
Right. I mean, and understanding that. And for example, Dr. Fauci must have felt like a president sending troops into war.
If only he had had that power to really organize it.
But in terms of just, its effect on the medical community and that sort of thing, and the responsibility, the heavy burden of that,
right,
on him has to be understood empathetically by the people that he was trying to help, which is all of us.
Absolutely. And I mean, it was at times a thankless job, at times a hostile environment. He certainly, I mean, it was no secret. He came on, he was receiving death threats. His family's receiving death threats. I mean, it's just untenable that this is the atmosphere in which a top-notch scientist like Dr. Fauci, and I would consider myself way further down on the notch, and a lower level scientist like myself are working in these types of environments. And certainly he was the face of it. And a lot that vitriol, was undeservingly directed at someone whose job is to protect the health of the public.
Right, right. Jayne, can we talk for a few minutes about a couple of topics that I think are captivating everyone's attention now? Artificial intelligence, genetics, and then how they fit together in terms of health equity. One of the ways that I think AI has an opportunity to affect so many lives is in the area of cardiology. We're all familiar now with the feature on the Apple Watch that can identify irregular heart rhythms. But now I'm reading about efforts at Mayo to use AI to sift through mounds of ECG data and try and identify those with the greatest proclivity to heart disease.
Sure.
And a group of companies, including Illumina and Invitae among them, kind of just came together to form a group espousing the benefits of genetic testing for sudden cardiac arrest, which affects 100,000 people a year in America. So one of the designations you have as the director of the COVID task force is health equity. And as the costs and the opportunity for health benefits collide here, how do we pay for it? And how do we make all that equitable?
And so I think, one of the things that's incredibly important about, what you just said is there are large parts of medicine that are moving directly to the consumer, that are in the consumer's hands, right? You can monitor your own heart rate. You can monitor your own rhythm. You can determine when you need to go to the doctor, when you need to alert them. And so I think that's incredibly important. And that whole area of wearables, if you will continue to grow as we continue to try to make certain that people have the absolute best information that they possibly can at the time to make those decisions. You know, artificial intelligence is here to stay. In some ways, we've had it for a long time. We're now naming it, or a few years ago, we named it. But this allows us, this is very much like research. It allows us to collate and get large groups of data and then draw conclusions about the data that can help society. We've always been doing that. We are now applying it in a clinical way. And I think that that's going to be very helpful. Heart disease is the #1 killer in the United States for both men and women. It is not breast cancer for women. It is heart disease. And so I think these are all going to be important. And when you talk about health equity, I mean, such a big ocean to boil. Where do we start there? So if we just want to talk about artificial intelligence with regard to health equity, many opportunities to identify where we can start to put those pieces together, including at your doctor's visit with your doctor, identifying patients, beginning to ask questions, social history questions, because we understand now that your health outside of the hospital is what's driving your illness inside of the hospital. And so we've got to be able to connect those two together.
One of the subjects that you've been talking about recently has been, and this again, I guess, goes back to health equity or clinical trials.
Mm-hmm.
I saw a study that came out of Tulane and was published in The Oncologist recently. And it was the first time that a prostate cancer trial had been run and included and focused on Black males.
Mm-hmm.
In spite of the fact that a Black male with the same low level of prostate cancer disease
Mm-hmm.
has a significantly higher chance of dying from that disease
Mm-hmm.
than a white male.
Mm-hmm.
The study pointed out that of 72 global trials for prostate cancer, 810 of 844,000 participants, 96% of a global trial
Mm-hmm.
were white males.
Mm-hmm.
How does that happen?
Yeah, and that's such an excellent point, and obviously you're right at the heart of the fire inside of me that drives me. One of my passions is increasing the awareness of the dearth of minority recruitment into trials and why that's important. And you just hit the hammer on that. You hit the nail on the head. Prostate cancer is a great example. This is a cancer that disproportionately impacts Black males, and yet the therapeutics that we develop to treat prostate cancer don't have the participants, by and large, who will mostly be the benefactors of it in the trial. And so the first time people are receiving any of these therapeutics is when it's already been FDA approved and it's out in your doctor's office or your hospital. And that's the first time maybe you are aware of any side effects. So you need it to be in the trial such that we can make sure these therapeutics that are developed are relevant, not only to you, but are relevant to all populations. When I say not you, I'm not saying only Black males should be in the trial because Black males have the highest degree of prostate cancer. I'm saying they should be a part of the trial.
Right.
Prostate cancer impacts everybody throughout the world. And certainly what we want to see with clinical trials now, we actually want to see a reflection of enrollment based on the prevalence of the disease in different groups. So you may see then different trials with different rates of enrollment of different types of people, depending on how it impacts those people. And so that is just a great example. I do a lot of work in this area. I serve as an advisor for Moderna on this area. I serve as an advisor for Novartis. And It's really something that we dig into. I have a lot of passion for it, as you probably know. I'm published in this area. So there is much work to be done here in the groundwork. And I am hoping to continue to move in this direction as we, at some point, get to the other side of COVID and begin to really move more and more into health equity with the Piedmont Healthcare system.
Right. So I noticed that you're doing a live version of the
Yes.
Stairwell Chronicles soon, focused on clinical trials.
Yes.
And unfortunately, this podcast won't air before that live episode.
Mm-hmm.
But my guess is that there will be a tape version available somewhere. Maybe you can tell us how to access that.
So a couple of things. My next live one will be March 28th, and it will be focused on the secrets of clinical trials. That's what I'm going to talk about for 30 minutes. I do them every month. My next one will be April 25th, part 2. And it's also going to be on clinical trials, focused on minority recruitment and the importance of that in clinical trials. So I'll be doing 2 Stairwell Chronicle lives. It's the last Monday of every month, 7:00 p.m. You can follow me on Instagram or Twitter at Dr. Jayne Morgan, Jayne, doctor, just Dr. Dr. Jayne Morgan, Instagram or Twitter. And you can always find any link to register for any of these 30-minute segments. Eventually, what I'm going to do is put up a website where all of these 30-minute segments will be housed, and you can access them on demand. Currently, my general Stairwell Chronicles, you can find them anywhere. Any of my social media pages, go on there, follow me, access whichever one you'd like, and listen to me talk for 60 seconds. You'll see what the question is, and you can decide if you want to hear the answer and move on to the next. I've probably done over 100 of them by now.
So you're also the president of the Southeast Life Sciences Association. That's
So
in fact how
I am the former president. We just changed over.
Okay.
We have a new president. So I was the very first co-president. So we just formed this organization, and I share the presidency. And so we were the very first presidents of this organization, Southeast Life Sciences. So now we've moved to our second president.
So you and I are here in Atlanta, and we probably have a little better feel for the vibrancy of the healthcare field here in the South than the average person who thinks about Boston and San Francisco and San Diego and that sort of thing. But what about what's happening here in the Southeast? What do you think are the most exciting developments in this region?
Oh my goodness. I think the Chamber of Commerce is just doing a great job attracting all types of technology businesses and sectors to this area. And we're really leveraging all of the colleges and universities and all this talent that we have. Not only our colleges and universities here, we've got 6 HBCU schools, historically Black colleges and universities, with all this technology. And I will tell you, I'm a product of one. I'm a graduate of Spelman College, and it's our HBCUs that have produced more than 80% of all the Black scientists and physicians in the United States of America have all come out of HBCUs. Imagine
out of 8 schools.
Out of all of the HBCU schools in the entire country, 80% of every Black physician or scientist went to an HBCU.
Wow.
So you think about that, including myself. And so these colleges are incredibly important. There's so much talent there. If I am an example, then please let me be an example. I'm a product of an HBCU. And so as we attract these kinds of businesses here, so we can reach all this talent that we have here with all these universities, all this brain trust, I'm super excited as I see all of this technology development occur, all of these businesses setting up here, large businesses setting up ancillary services here like Microsoft, Google are all moving offices here. We've got to understand that's because we have the population that can support this type of technology and this type of dynamic.
So as COVID wanes and you're taking the Stairwell Chronicles in this new direction, what's next for Jayne Morgan?
And so, I am working with Piedmont to see where we want to start in our foray in the health equity space, in our social responsibility space. And what does that look like? And I'm sure it's no secret that many of the other hospitals here in the area, have chief health equity officers. So we are in the process of looking at that, sort of, restabilizing in this lull. I'm reticent to say that we are post-COVID as I see the numbers upticking in Europe, as I see our wastewater samples increasing. So let's just say we're in this lull where we're able to kind of reset and regroup. And I will say to your audience, I don't know when this is being aired, this is the time to get vaccinated if you haven't been vaccinated. Get your booster if you haven't gotten your booster. Make sure you have N95 masks, stock up on them. This is the time to stock up on your COVID test if you don't have them. Take advantage of this time to kind of take a deep breath and reset, because we may not yet be out of this. In fact, I'm pretty confident that we may not see the brutality of the previous surges, but we certainly have a very still high death rate. If you were to think about it, we are being fairly cavalier, but we still have 1,000 people a day dying from COVID, and we're just numb to it. It's mind-boggling that 1,000 people die a day from COVID, and we have people saying, well, I'm over it. I'm done with it. I'm not interested. Well, COVID might not be done with you. So I want you to take this period of time and shore up your defenses. Time to get vaccinated, time to get your masks, make sure you have a supply of test kits, and prepare for the next thing. Those who don't learn from history are destined to repeat it.
That's really good advice, Jayne. In fact, I know that I'm approaching my 65th birthday. In July the 10th, and somewhere around July the 11th, I will get another shot.
Yeah.
So I don't know that I'm looking forward to it.
No.
But it will happen.
Right.
So it's great advice. I'd like to thank you for being our guest here today.
Thank you for inviting me, Tim. I'm thrilled. I appreciate this. Thank you so much.
I wish you all the best on your trip to Switzerland. Thanks for tuning in to the Life Sciences and Biotech podcast. We'll see you in the next episode. The information contained in this website and podcast are purely informational and not considered investment recommendations. Tim Dougherty's participation in Biotech Insights is separate and apart from his role as an investment advisor representative. Nothing contained herein can be construed as a recommendation or endorsement of any of the companies discussed. Tim Dougherty also has no financial affiliation with any of the companies mentioned in this communication. Tim Dougherty makes no representation that the information contained in this material is accurate and is under no obligation to update this information as changes occur.